Welcome dear students, I am Dr. Pratyusha. We have already learnt about physiology of hearing, assessment of hearing and various ear disorders which cause hearing loss and also the types of hearing loss. But now comes the most important part, and that is rehabilitative methods. After identifying everything, finally what you have to do is to rehabilitate the hearing impaired patient. It is essential that they are equipped enough to work with their full capacity and lead life with the highest possibility. Okay? So all hearing impaired individuals need some sort of rehabilitation, mainly for communication. Now what are the available methods? Let us see. Rehabilitation can be broadly understood by two headings, and they are: first is taking the help of instrumental devices. There are various devices that can help. And second is training of the patient. Training comprises of various things like speech reading and other things that I will explain. So in instrumental devices, we again have three categories, and they are: first one is hearing aids. Second one is using some implants. And the last one is assistive devices. Let us learn about all of them one by one in detail. It is essential that you understand the mechanism by which each of this works and selection of patient. Which patient requires which device among the ones that are available. Okay, so we need to understand the mechanisms, indications and contraindications for each of them. Okay, so let's begin first with instrumental devices, that is hearing aids. In hearing aids also we have various types, but first let us understand the basic mechanism of a conventional hearing aid. What does a hearing aid exactly do? It picks up sounds, it amplifies the sounds that it picked up, and then it will send it to the ear. Because the patient is having hearing loss, this amplification of sound will greatly benefit the patient. So let us see what are the three parts of a conventional hearing aid. If you understand the conventional hearing aid properly, the rest of them are easy because they are just a few modifications and improvisations for this conventional hearing aid. Okay. So this conventional hearing aid has three parts. The first part is a microphone. What does a microphone do? Not just in hearing aids, generally anywhere in social programs also we use a mic, right? What is the function of a microphone? It picks up sounds and converts them into electrical impulses. That is why electricity is required for microphone functioning. So what does a microphone do? Microphone picks sounds and converts them into electrical impulses. This is the first part. The second part is an amplifier. What does an amplifier do? As its name suggests, it amplifies the sound, it magnifies. But what is it magnifying? Now the sound is already converted into electrical impulses. So this amplifier magnifies the electrical impulses. That is its function. And then we have the third part, which is receiver. What does the receiver do? It again converts the electrical impulses to sound impulses, because our body cannot decode the electrical impulses as it is, right? So receiver converts electrical impulses into sound. These are the three parts of a conventional hearing aid. Now there's a small tricky aspect here. When you see these options in MCQ questions, receiver means suddenly our basic common English knowledge suggests that that is the part that is receiving sound. So please be careful, it is not like that. It is the microphone which receives sound, and a receiver is that part which is present inside the ear that is converting electrical impulses into sound impulses. Okay, so please be careful about that aspect. Now this sound, amplified sound, is then carried through the external ear into the tympanic membrane. The sound is amplified so the patient can hear better. After learning this, let us now look into the various types of hearing aids that are available. Types of hearing aids. Now, in hearing loss, we have two broad types. What are they? One is conductive type of hearing loss and the second is sensory neural type of hearing loss, isn't it? While learning about the physiology of hearing, we saw that there are two types. One is air conduction and second is bone conduction. Similarly, in hearing aids also, we have two types. And what are they? The first one is air conduction hearing aids and the second one is bone conduction hearing aids. This is based on their mechanism of action. Bone conduction hearing aids. What does an air conduction hearing aid do? The amplified sound, it transmits via the ear canal to the tympanic membrane. So the external ear is being used. Through the external auditory canal, it transmits that sound to the tympanic membrane and then into the middle ear, and finally the process continues. Whereas a bone conducting hearing aid, instead of having a receiver, it has a bone vibrator. Now this bone vibrator is put on the mastoid bone, and then it directly stimulates the cochlea via the bone. This is bone conduction in general, isn't it? Going via the bones. This bone conducting hearing aid will directly transmit the sound into the cochlea. Now, why do we need such devices? Because this is very useful in patients who have external ear problems such as otitis externa, or more importantly, imagine in children who are born with congenital anomalies, they have atresia of the ear canal. When the entire ear canal is occluded, there is no ear canal at all, there is atresia of ear canal, you cannot put any hearing aid or anything into that, isn't it? That time this bone conducting hearing aid becomes very, very important. They cannot wear any ear devices, external ear devices. So bone conducting type of hearing aid becomes important in them. And also in people who have actively draining ears, there is active discharge all the time. Maybe there is mastoiditis or otitis media, severe otitis media, reservoir sign, and the ear is always draining. In them also you cannot put any external device into the ear, and these bone conducting hearing aids are useful. So I hope you have understood these two types of hearing aids, air conduction and bone conduction. Okay. Now most of the aids are of air conduction type. In air conduction type, we again have subcategories. Let us look into those subcategories now. First one, among them is body-worn types. This is the most common type. It has a microphone and an amplifier. Of course, because electricity is needed, a battery is put inside. We can't connect the person to electricity, right? So we put a battery inside. And this microphone and the amplifier is put on the body at the level of the chest. And the receiver is put at the ear. Okay, so this type of hearing aid allows good amplification, and also there is minimal feedback. It's useful in people who are very deaf, who have severe deafness, and also it's useful in children with congenital deafness. Now we have to understand what is this feedback effect of hearing aids, not just for these body-worn types. Generally also for many hearing aids, this is a complaint. Feedback effect means when the hearing aid is not appropriately fitting into the ear or because of some other problems, what happens is that amplified sound, instead of going into the ear, will again come back and stimulate the ear, and it will cause a type of whistling sound. Now, if I have to explain it to you in the way that you understand, sometimes when we use malfunctioning mic in certain events, we hear that annoying beep kind of sound, isn't it? Yes, that exactly happens in hearing aids also when they are malfunctioned or when they are not fitting properly, or maybe because there is some excessive wax in the ear canal. All these can cause feedback effect. Now these body-worn types have minimal feedback effect. That is the good part about them. Okay, so let me briefly write down what is body-worn type. You have a microphone and an amplifier that is put at the level of the chest, and also there is a receiver that is placed at the level of the ear. Okay, and what is the good part about this? The advantage is that of this type is there is good amplification of sound, and also the feedback is minimum. Is this clear to you? Now let us move on to the next type after body-worn type, and that is behind the ear types. Behind the ear. In short, this is called as BTE, behind the ear. Now in behind the ear types, everything, the microphone, amplifier, receiver, everything is put at the ear itself. Okay, all of them are one unit. They are not separate parts. The battery, the microphone, the amplifier, all of them comes as one single unit, and you put that entire thing behind the ear. And this apparatus is connected to the ear canal. There is a small tube like thing and it is connected to the ear canal. This is useful in moderate or mild type of hearing loss. Okay, in behind the ear, the entire apparatus is at the level of the ear and a connecting tube is placed in ear canal. Okay. The next type is a spectacle type. What is this spectacle type? Now in patients who need spectacles also and hearing aids also, this idea was generated for them basically. It's a modification of behind the ear type. What we do is, the patient will wear glasses, and glasses will have these edges, right, which are put behind the ear. In that frame, this entire auditory apparatus is put. So they can just wear glasses and that will address their vision problem plus also the hearing aid. Okay, and also the hearing aids are not very conspicuous. All that you see is the glasses. Okay, So that was the idea behind spectacle type, but I think I can say they're almost obsolete now. Nobody uses them, okay? Next. The next variety is in the ear type. We had behind the ear and now it is in the ear type. ITE. In the ear. Now in this, that entire hearing aid, it has already become one unit in behind the ear type itself. The microphone, amplifier, battery, receiver, everything is there as one unit. And this is put in the ear. You can see it in the concha. It is put as an ear mold and that is worn in the ear. Now this is useful for mild to moderate type. And the good part about in the ear is they're cosmetically very, very appealing. Now please understand that it's not as easy to convince a patient to wear hearing aids as it is to convince them to wear spectacles. Okay, spectacles are also a type of rehabilitation, isn't it? But you see that most people will be willing to wear glasses without any hesitation or inhibition. But it's actually difficult to convince patients to wear hearing aids. There is some hesitation and inhibition, and most patients will not be very happy to wear hearing aids. So cosmetically the better, the higher chances of compliance. So in the ear type, the entire device is going into the ear. You can just see a small part in the concha. Okay, so that is in the ear type. The entire apparatus is placed in the external ear. What is the advantage with this? It is cosmetically appealing. Now, even better than in the ear types are canal types. This is the last variety. Canal types. In canal types, again we have two subcategories, in the canal and completely in the canal. In the canal and completely in the canal. Okay, CIC and ITC. Now this hearing aid is so small that the entire apparatus, you cannot even see it in the concha. It's pushed into the external auditory canal. So cosmetically it's even more better. That small part in the ear type, in the previous type, at least a small part was seen in the concha, in the pinna part. But this category, it completely goes into the external auditory canal. How is that possible? Because they made it very, very small. But patients should also have slightly wide external auditory canal for this to work. Okay, they should have a nice large and wide canal, and they should be able to nicely fit it inside. Okay, so this is also useful for mild to moderate type of hearing loss. Completely in the canal one is even more small. It is almost invisible, I can say. Okay, so these are the various types of hearing aids. What are the 5 types? Let me quickly revise them for you. One is body worn type, and second is behind the ear, third is spectacle type, fourth is in the ear, and fifth is canal type. Spectacle type is almost obsolete now. I can tell the first 3 are not really used now. What we use is in the ear and canal type. Okay. Before moving forward, let us understand what are the indications for a hearing aid. Who should use hearing aids? Now suppose a patient has a tympanic membrane perforation. Will you prescribe hearing aids for that patient? Because hearing loss is there in tympanic membrane perforation, hearing loss is there. But do we do that? No. We try to surgically correct the defect. Now when you can surgically correct defects, why do you need hearing aids? There are certain indications. Now the first indication, as I just told you, is the hearing loss is not medically or surgically correctable. Or second is surgical correction is possible, but in that patient is not a suitable case for surgery. Suppose the patient has high comorbidities or some severe bleeding disorders in whom you cannot perform any type of surgery. then also the patient is a candidate for hearing aids. Not just this, there are many other indications. Let us look at them one by one. Indications for hearing aids. If the patient is having sensory neural type of hearing loss, and this sensory neural hearing loss is affecting the quality of life of the patient, then we try to use hearing aids. But the problem with sensory neural hearing loss, you also have learnt it while learning that it is something called recruitment phenomenon. What happens in recruitment phenomenon? The patient cannot hear anything up to a certain level, and suddenly the sound gets very high, it gets amplified, and the patient becomes intolerable to that noise. I told you this typical example when you're speaking to really elderly people. You speak and they can't hear, you increase your volume and they can't hear, and you further increase, and then they suddenly say, why are you screaming and shouting? Yes, have you faced this? So that is because of recruitment phenomenon. And people with recruitment phenomenon are bad candidates for hearing loss. If they do not have recruitment phenomenon in sensory neural hearing loss, it's very nice to use hearing aids. Okay. Next, second scenario is deaf children. Now we have learned hearing loss in children as a special topic. What makes it very important? Because their development of speech and learning is dependent on their hearing capacity. So it's essential that we rehabilitate children as early as possible, preferably before their speech learning occurs. Okay. So in them, sometimes even before the exact cause and the treatment is found out and before surgery is done, first, immediately when we identify a deaf child, we put on hearing aids and try to make them hear something so that they can learn how to speak. Okay, even to train them otherwise also, hearing aids are useful. Next, in conductive type of hearing loss also, hearing aids are useful. When is that? When a surgery is tried, but the surgery got failed. Suppose there was a middle ear reconstruction was done, but even after doing that, the patient could not achieve 100% hearing. Not 100%, if there is considerable amount of hearing loss even after the surgery, or as I said earlier, this patient is not a suitable candidate for surgery, then we can go for hearing aids. They will get benefited with hearing aids. Okay. So these are broadly the three indications for hearing aids. They're nothing but the types of hearing loss and when you can use hearing aids. Okay. But before prescribing hearing aids, you have certain prerequisites that you as a doctor must know. In whom to prescribe and how to prescribe. Okay. You just can't write hearing aids and send the patient, right? You have to keep in mind so many things. That too, when there are so many types of instrumental devices, we have hearing aids, we have implants, we have assistive devices. So how to select and all, it's very important. For that, these are the prerequisites. What are they? First one is the degree of hearing loss. Now, if the patient is having very mild type, and they're able to manage say 20-25 decibels hearing loss, we don't have to prescribe anything. The patient's day-to-day life is very normal, so they don't need any extra effort. Okay. Second, so you have to assess the degree of hearing loss first, and depending upon the degree also we can select our device, right? And then we should find out the type of frequencies that are affected, because for high frequency hearing loss there are some devices which are suitable, and for low frequencies there are some other devices. So we should know at which frequencies the patient is having maximum hearing loss. Okay. And of course the type of hearing loss. What do I mean by type? Either it is conductive or sensory neural type of hearing loss. We should find out that also. And if it is sensory neural type of hearing loss, I told you recruitment phenomenon is important. Is that present or not? Because patients with recruitment phenomenon are poor candidates. No recruitment is good. Since we are anyhow talking about recruitment, what happens in recruitment? It becomes intolerably loud for them, right? So in any patient, we have to find out what is their maximum level of tolerance, the loudest sound that they can tolerate, okay? That has to be found out so that we can set the volume of the hearing aid that is comfortable to the patient, okay? The next consideration that you should have is the age of the patient. This is very important. Usually in people with presbycusis who are very old, we prefer prescribing hearing aids rather than doing complex surgeries on them, isn't it? Okay. So age of the patient is important. After age, you should also look into the condition of the external ear and also the middle ear. Because this hearing aid is going to sit in the external ear. As we have discussed earlier, if the patient is having otitis externa or some other tumor or mass in the external ear, we cannot put this device, right? So it's essential that we check the condition of external and middle ear. Are they compliant to take the device or not? Then, what is the cosmetic requirement of the individual? Cosmetic requirement of patient. Now, some people are okay even if their hearing aids are seen, while some people do not want the hearing aid to be seen. So, based on that also you have to make decisions, okay? And that differs from individual to individual, because higher the cosmetic appeal, usually higher the price. So all these things have to be kept in mind and decided, okay? And the type of ear mold. Ear mold is that device which is sitting in the ear. And finally, the last thing is the type of fitting. What do I mean by type of fitting? We have two types. Monaural means only one aid in one ear. Binaural means for both the ears we put two aids. Or sometimes there is another peculiar thing called binaural with a Y connection. That means there is only one aid but there are two receivers, one for each ear. When is that used? When there is a profound deafness in one ear, we put an aid here but the receiver is placed in both the ears. Why receiver is placed in both the ears? Maybe this ear is having some inner ear problem also. We cannot discard this ear completely, right? So we put the aid here and the receiver is put in the other ear. Now what is the advantage of putting an aid in this ear, in the deaf ear? Because when we have two ears, what is the advantage of having two ears? Localization of sound. Because we have two functional ears, we can locate from where the sound is coming. For that, you should know, brain detects from which side the sound is coming. So it is essential that both the ears pick up sounds. For that purpose, we put a hearing aid in the deaf ear and receivers we put in both the ears. So that is a binaural aid with a Y connection. Is that clear? So in the type of fitting, what are the three things that we have? Monaural, only in one ear, binaural in both the ears, and the third one that I told you is binaural with a Y connection. What is this binaural with Y connection? One aid with two receivers. Is this clear to all of you? So with this, we have understood about the basics of hearing aids, what are the conventional hearing aids and what are the prerequisites, what are the types of hearing aids and everything. In instrumental devices, we have completed the first part, that is hearing aids. We have various types of implants and assistive devices about which we shall learn in the next video. Most important is two, bone anchored. In hearing aids, after the conventional hearing aids, after these five, there is another very important category called as bone anchored hearing aids. After that, we shall learn about implants and assistive devices. Thank you very much.